What we most commonly do in a stomach surgery is to repair stomach hernia, because most of the patients have this problem. This causes the stomach lid not to function properly. What is done in the operation is the reparation of this hernia and creation of a new lid mechanism. When we do it with the help of the robot, we can enter from a single hole. We even performed the first surgery done through single entrance here in 2011. Well, in all hernia operations there is a risk for the disease to recur. This of course depends on the personal characteristics of the patient. If the patient is overweight, exercises hard, does any activity with straining, then the possibility of reoccurrence increases. Nevertheless, statistically this ratio is around 6%. Reflux operations under standard conditions take 30 to 40 minutes. We hospitalise patients for a night normally. The next day they have a mild breakfast. We discharge the patients who live in Istanbul that day by noon. We recommend patients who are coming from abroad to stay in the hospital one more night. After 3 to 4 days they can fly back to their hometown and are able to practice daily physical activities. The most serious complication that may be faced in the early stage is difficulty in swallowing. But if the monometric examinations are done properly before the operation and the operation is handled accordingly, we never noticed a difficulty in swallowing function in our patients. If there is a chronic reflux due to a mechanical dysfunction, then the surgical treatment should definitely be the preferred treatment method, because there is no other option. For that reason, the preliminary examination prior to the surgery is of great importance. If a patient has a stomach hernia, especially bigger than 4 centimeters, if he has had this problem for a long period of time, if he benefits from medicine treatment but the same reflux symptoms reoccur right after he stops taking the medicine, if collateral findings, other than classical reflux symptoms begin, if cell degeneration, which we call metaplasia, developed, then we recommend surgical treatment.